Worms are parasites that can be transmitted through contact with poop and contaminated objects, nose-to-nose contact, or by drinking water or eating food containing eggs of these parasites, and they're super harmful to our pets and can be transmitted to us humans as well. That's why it's super important to know how to spot if your dog might be carrying a gastrointestinal parasite or not. Signs of worms in dogs. There are many signs that can show that your dog is infected with gastrointestinal parasites, and in this video, we're going to share 8 signs that you should definitely look out for. Changes in appetite. Loss of appetite or suddenly eating lots more can indeed indicate that your dog is infected with parasites. But why is that? An increased appetite happens because the parasite feeds on almost all essential nutrients in the animal's body. So, as a form of protection, the body increases its appetite to try and make up for those losses. On the other hand, a lack of appetite happens because the presence of the worm in the body irritates the stomach lining. So the animal ends up feeling nauseous and not wanting to eat. Weight loss. If your pet is always eating and yet doesn't gain weight, or worse, even loses weight, that's a strong sign that they might be infected with gastrointestinal parasites. And why does that happen? Because most of the time the presence of the worm in the gut lining causes inflammation, and the inflammation can be so severe that it impairs nutrient absorption, which then leads to a malabsorption crisis. Vomiting and diarrhea. Frequent vomiting and diarrhea are also strong indicators of worm infection. Bloated belly. A bloated belly and abdominal distension can be a result of the movement, multiplication, and gas production of these worms. Weakness and lethargy. Dogs infected with worms can show weakness and lack of energy. Weakness and lethargy can be signs of anemia caused by the parasite. The host loses blood through tiny lesions in the stomach lining caused by parasites, and the parasite also sucks blood, adding even more to the anemia. But of course, we can only know for sure if the animal has anemia through a blood test. Some clinical signs point to anemia, like pale and dull mucous membranes, weakness, and lethargy. Excessive itching and licking. Itchy and excessive licking in the anal area may indicate the presence of worms. Not all types of worms cause this symptom, but some do, so keep an eye out. Presence of worms in feces. If you notice worms in your dog's poop, the infection is almost a sure thing. But just like itching, not all worms can be seen by the naked eye in your pet's poop. But if you see worms in fresh poop, the infection is a surefire thing. Blood in feces. Several diseases can cause blood in the feces, but for worm infections, blood in the feces means your pet might have gastrointestinal bleeding. Even if the bleeding is small, it can contribute to anemia and all the other anemia-related signs we've already talked about. Poop with blood, no matter the cause, is not normal and should raise a red flag. Diagnosis and treatment. If you see any of these signs in your pet, head straight to a veterinarian. Only they can make a precise diagnosis, identify the parasite, and choose the right treatment. Treating worms is usually done with a dewormer or a worm killer medication. They will kill and eliminate the worm from your pet's body, but the vet should be the one making the treatment decision for your pet. They'll consider your pet's overall condition, the type of worm, and will recommend the best treatment for the case. Prevention and care. Prevention is always the best medicine. Keep your vet appointments up to date, follow the recommended deworming schedule for your pet, and maintain good hygiene and cleanliness habits to ensure your doggy's health.